While it's important for those of all ages to pay attention to their health, North Dakota Health and Human Services says men aren't taking the initiative to ensure they're in good health. Nye Remy joins us, and she has a personal story of overcoming the odds to be healthy. Nye?
Good morning, Nicholas. The man you're about to meet says a medical emergency got him to realize he needed to take better care of himself. And that emergency happened at a fast food drive-thru.
How often do men think about their health care here in North Dakota? According to the Health and Human Resources website, men live an average of 7.8 years fewer than women in our state, due to them being more likely to delay seeking physical health care. Just like the man I met in Bismarck, Jerome Cash says that he personally went through this, and it all started at the age of 12.
At a young age, I never did go to the doctor. That wasn't part of the growing up. You know, you didn't have time for that. But learned to regret it by the age of 30, because that was when I was at work one day and I couldn't breathe, so I called for my wife to call the ambulance, and I met him and ended up having my first heart attack actually right here in McDonald's.
According to statistics, for some men, they just don't think it's necessary to see a doctor because they may feel fine until one day they don't. Castro says that he did not just have one attack, but several.
I've had 6 heart attacks, 26 stents, and they say I'm depressed nowadays. So.
Castro hopes to encourage others to take better care of themselves before it's too late. After hearing his story and realizing how many men have been neglecting their health, what are we doing to decrease the death rates and health risks within our state?
What are you guys doing to ensure that North Dakota is partaking in Men's Health Month?
We're really trying to raise awareness of the need for men and boys to live healthy lifestyles, and that includes going to a healthcare provider, getting some preventive health screenings, making sure that they know their numbers, such as, you know, their blood pressure, height, weight. Would really like to encourage men, families, healthcare providers to recognize that men don't seek care as often as women do, and that their rates of chronic illness, heart disease, and stroke are higher.
Askew says that a good number of men don't only neglect their physical health, but their mental health as well.
Also, suicide is higher in men than in women. It's in the top 10 causes of death for men, whereas it's not for women.
And with the rate of women going to see a doctor more than men here in North Dakota, can you tell me why, in your personal opinion, that is?
And it might be that there's just less of a natural progression for men to continue on with their healthcare provider after having a pediatrician, maybe when they were growing up. So as an adult, women often transition to seeing an OBGYN, whereas men might not have that natural progression.
According to North Dakota Behavioral Risk Factor Surveillance System survey, nearly 1 in 10 men hadn't seen a doctor in the last 5 years, resulting in higher rates of death from cancer, diabetes, heart disease, and suicide. In fact, Nicholas, heart disease is the leading primary cause of death for men, and suicide ranked in the top 10 primary causes of death for men.
Nye Remy reporting. Nye, thank you very much.